Hi, my name is Keturah Beiler, and I'm one of the nurses that works at the Clinic for Special Children in Strasburg, Pennsylvania. And I've been there for about 2.5 years and work on a clinical team with Dr. Strauss, as well as doing home visits for babies who are born with lethal genetic disorders. For me, coming to work is kind of like going home. My parents were Old Order Amish, and then left that church and went to a Beachy Amish church that I was raised in, a Beachy Amish church. En ik deed hier in Pennsylvania Dutch, bij Bissell. So I love this community. I feel very much at home at the clinic and privileged to work there. Thank you for the opportunity to talk about the Clinic for Special Children. The children and the families that we see there are inspiring to me, and we love serving them. Thank you to the auction committee. Thank you for the hard work in making this day happen. I know that this is Leon's last year as the chairman, and we appreciate all his hard work for the last 12 years. One of the ways that Adam Heaps, our executive director who's here today, invited me to come, or one of the things that was enticing to me, is he talked a lot about Shiloh Auction's soft pretzels. So we have soft pretzels, Annie, and soft pretzels in Pennsylvania, and those pretzels are amazing and yummy, but I have to say that the ones for sale here may be the best that I've ever had. So thank you for having us here today. Greetings from all the staff at the Clinic for Special Children. Greetings from the lab. Our laboratory scientists, one of the programs I'm going to talk a little bit about is called the Plain Insight Panel. And this is a panel that tests for 1,300 different genetic variants. With one blood draw, the lab can test to see if a person is a carrier for one of these 1,300 genetic variants. And it's important to know this if for you and your spouse, if you both have the same genetic variation, there's a 1 in 4 chance that the children will be affected. Early treatment of babies before they have symptoms can make a difference in a child's life. So I want to thank all of you for coming out and making a difference in the children and families that we serve, not only at the Clinic for Special Children, but also the DVC and other clinics. So at the clinic, we do patient-centered research and patient care. I see these two things, research and patient care, as 2 tracks on a railroad. We at the clinic make forward progress by using both tracks or rails. The research track helps us collect information and measure the needs so that we can work toward helping and curing genetic disorders. The clinic has been involved in exciting research for treating spinal muscular atrophy, or SMA, and gene replacement therapy. This new therapy has the potential to see many of our children lead a healthier life. Today, I want to draw attention to the inspiring families that we serve, and I'm going to do that by telling you 2 stories. One has to do with the cure and the difference that research has made, and the other is about a family where cure has not happened, and it represents the other rail in the railroad bed. So this week, we saw a 1-year-old boy who was dosed with a one-time infusion of life-saving therapy at our local hospital when he was approximately 1 week old. He has 2 siblings in heaven who had the same genetic disorder and did not live beyond 6 months old. Their brother, our patient, after having a one-time infusion of the life-saving therapy, is now a chubby, blonde-haired, blue-eyed, happy baby boy who's taking a few steps on his own. How exciting it has been to be a part of this monumental discovery. Then there is the other rail that we operate from, and that is represented by the families who right at this moment are in the middle of the struggle that comes with having a child or multiple children with severe disability. We at the clinic also desire to walk alongside them to make their journey easier. Sometimes it means being a listening ear and providing support. Sometimes it means prescribing medicine to make distressing symptoms better. Something I'm passionate about as a nurse is reaching out to families who are facing the loss of a baby through a genetic disorder that they have. This past year, I've done many home visits for these babies, such as Timothy, which is not his real name, He was the third baby in the family, born with a head so small that his brain was not developed in a way that can support life much past 1 year old. What a painful time for the family. These types of disorders do not have a cure in their future, and it is our goal at the clinic, and I'm sure at the DDC as well, to support these families in their time of need. We love these children and cry with mothers as they hold and enjoy their baby for one more day, knowing their arms will be empty soon. I have met so many inspiring families. Timothy's family in particular had 3 healthy boys, did not know that the genetic disorder was in their family, and their 4th baby was born with Amish microcephaly, and he died when he was 3 months old. The next baby was born and also passed away. The 3rd baby was born with the same genetic disorder, passed away when he was 1 year old. How do they do it, we say? I don't know the answer to that, except that they take one day at a time. They say things like that they do not get to choose their pain, but they choose to live joyfully and not bitterly. I was with the family 2 weeks ago to deliver the quilt with their baby's footprints stamped on it. We sat with the boys, who in their short years already faced losing 3 siblings to genetic disorder. Now this baby is blessed with a healthy baby girl. This story represents one of many similar stories that I know happens here in Shiloh and in Lancaster County. The last baby that passed away chose to come under the clinic's care, and we did prescribe medicine. The doctors there, Dr. Strauss and Dr. Carson, prescribed medicine to keep him more comfortable and supported the family. So one of the reasons, or the reason that I tell you these heart-wrenching stories is to give you a glimpse of the families that your involvement and money impact today. The tears and adversity serve as our motivator at the clinic to keep working hard to provide ways to help these children and families. We work, we struggle, we rejoice at the progress of the clinic, or the children who come to the clinic. It is my honor to allow you a little look into the inspiring families that we serve every day. Our goal at the clinic is to reduce suffering in children, the most vulnerable among us. We all have a special place in our heart for children, and thank you in advance for being generous today. Your involvement makes a difference in the lives of the brave children and the courageous families the Clinic for Special Children and the DDC serve every day. Thank you.